This patient was referred to me for endodontic retreatment of tooth number 30. According to the patient, the root canal was done a few years ago. Patient is about to get a shoulder replacement surgery, so he needs dental clearance. So he saw his dentist, and his dentist took some PAs to make sure there are no dental related problems, and noticed this periapical relucency. Tooth will also need a new crown. So the patient was referred to me so I can redo this root canal. As you can see, as I said, PFM crown, previous root canal, broken file, some root resorption here, periapical relucency. Look at the distal, short fill, but no periapical relucency. So again, remember Dr. Lin's study, long, short, flush obturation. The extent of obturation has no effect on the success rate of endodontic treatment. Only bacteria can affect. So in the distal canal, he filled short, but there was no microorganisms, no bacteria. So as you can see, no periapical relucency. Mesial, he broke a file, probably had microorganisms on it. Broke a file here, left necrotic tissue, bacteria beyond the file. As you can see here as well, filled, I don't know how he filled that canal there, the mesiolingual canal there. The broken file was in the mesiobuccal canal. And so left necrotic tissue and bacteria behind, and that's why this patient now has a periapical relucency and some root resorption there. So we discuss options with the patient, and patient decided that he wanted to try to see if we can save the tooth for him. This is another angulation of the tooth, and you can see the broken file here, root resorption there, but the distal is clean. And this is another angulation again. You can see the crown here, short fill there, no periapical relucency there, broken file here, periapical relucency and some root resorption, apical root resorption. So endo access was made through the PFM crown, and instead of finding permanent buildup material, well, I found cavit and cotton pellet in the pulp chamber. The cavit, once I removed the cavit and found the cotton pellet in the pulp chamber, the cotton pellet was just soaked. It was just wet. And this is the cotton pellet that I pulled out. Actual cotton pellet that I pulled out. All right, so removed all the gutta percha. The broken file was in the mesiobuccal canal. Remove the broken file and take a look here. That is the actual broken file right there. That's the cotton pellet that I removed, the broken file right there. And here's the post-op. So the broken file was there, as you can see. I had to enlarge the canal so I can remove that broken file. I was able to regain patency in all three canals. Right there. And look at all of this anatomy. Look at all this anastomosis between the mesial canals. And as I said, the distal canal, I was able to regain patency in all three canals. Everything went great. Went ahead and temporized the tooth and referred the patient back to his dentist. As I said, that this dentist will cut the crown off, build the tooth up, and put a new crown on it. But as you can see, everything went great. This is another angulation of the post-op. And this is another angulation. And another angulation.